Those pens, the brand name, the Ozempic and Wegovy and Mounjaro, those pens are preloaded at a dose that you can't control. It's just the dose that you get. Yeah. And so those are starting, in my opinion, too high for most people. And then they're being ramped up over about 16 weeks very quickly to these extremely high doses.
30% people saying they're throwing up, 80% feel nauseous.
Those are inflated stats. Anytime anyone goes through severe caloric restriction, they're going to lose 20 to 30% of their muscle mass. And I think they're being dosed too high, too fast, and it's crushing them. It's crushing their appetite. They're not eating. They're going into a malnourished state, and they're wasting away. This is when I remember sitting on the couch looking at my phone and turning to my husband and being like, they're lying, because they work and they heal you. I mean, they're healing, they're regenerative. Snack food companies are very concerned. Dialysis clinics, type 2 diabetes is very profitable. There's a lot of industries that have something to lose here. My followers started messaging me saying, I'm so glad your podcast came out and I was able to get the real information, because I went home and I'm 20 pounds lighter and all my PCOS and diabetes is reversed, and my relatives who are, all boosted up and on 5 different medications were shaming me to no end.
Ozempic. I don't think there's any drug that's been as talked about or misunderstood as Ozempic. And today I'm going to be talking with Dr. Tyna Moore, and she's an expert on regenerative medicine, stem cells, and hormonal health. All things that we're going to discuss within this episode, and all things that impact someone's overall weight and risk of obesity. This episode is all about giving you a holistic look at what factors lead to obesity and what the health outcomes are when obesity is left unchecked, not only during adolescence, but during adulthood. There is a lot to talk about. Welcome to the Gabby Reece Show. Let's go. Dr. Tyna Moore, but we're going to refer to you only as Dr. Tyna. Is that what we?
Whatever.
How are we going?
Yeah, just call me Tyna. It's fine.
Okay. Thank you for coming. And I have to tell you, in doing my research for this, I will be completely transparent. I try to be a person who views themselves as open-minded, willing. I always think the willingness to change your mind is really important, especially as you get older, the willingness to learn something new, to apologize, to say, hey, I really believe that was right, and now I'm learning something new. And it's the same thing on the conversation of Ozempic. And because, okay, so I'm here, of course, I live in part of the time in Los Angeles. So you hear about, thin people just getting thinner,
right,
or people using it as a hack to, getting thin. And for every pound of you lose 2 pounds of muscle. Like, you hear all these kind of broad stroking. And because maybe it wasn't interesting enough for me, I didn't really go beyond that. And I probably did have a bias for sure. And after doing the research, it's a very interesting conversation, because first of all, Ozempic is the drug name Novo Nordisk. Is that right? Okay. And that's really the delivery system. Is that right? Because you can't patent a peptide.
Right.
So let's start there.
Okay.
This is a peptide.
Right.
And it has been packaged in a delivery system so everybody can make their money, whatever. They're the 12th most valuable company in the world, and, number 1 in Denmark. But the Ozempic itself is a peptide.
Right.
And you have been using it for a long time.
I've only been using it since last early fall.
Really?
I was also very skeptical and kind of listening to the propaganda around it. And then I don't speak on things I don't understand. And my podcast producer actually was like, you need to do an episode on Ozempic. And I was like, I'm going to wait and see how this shakes out, because the media frenzy around it was getting louder and louder. The functional medicine community online, the influencers, everybody was trashing on it. And I was like, I'm just going to wait. I'm kind of an observer, just sit back and see how this shakes out. And I mentioned my mentor off screen, but he was a regenerative medicine expert, and that's what my background is in. So I was doing prolotherapy and PRP and stem cells way before it was cool. And he was, he's the one that brought that to our profession decades ago. And I knew that he would love this. Like, when I started looking into how it worked, I was like, oh, this is right up my alley. This is regenerative. This is not what I'm hearing. So I kind of laid low. And then I thought, okay, all my followers were like, what's your opinion? And I thought, well, I have to form one. So I'm going to research it. And in my research, it was not lining up with what we were hearing. Mm-hmm. Exactly.
How do you, I mean, I think in this day and age too, and then when you hear like, the medical journals are even sort of purchased at this point, these places that were gold standards for information, they've been compromised. So when you're trying to really get down into the research, where are you able to, and do you cross-reference? Do you call other people and kind of get their take on it? How do you do that?
I called everyone I knew who might be using it in their practices. So I called all my colleagues and I said, are you using this? And you'd be shocked how many were using it for weight loss. And many of them were working with people like you and I, like people who were aging well, very metabolically sound, exercise, lift weights. They were using it in low doses. That was, around the starting dose, and kind of being able to keep patients there. And the people they were using it on were just the gamut of people in their middle age who just kind of get that extra, 10, 20 pounds. They weren't using it for vanity, but when you start packing on 20 pounds in your midsection, you're looking at insulin resistance, which is kind of the beginning of a lot of issues. People don't appreciate that. But they were using it successfully for that. And I said, are any of you microdosing it for all these other reasons I'm finding in the literature? Like, the studies go back on GLP-1s 20 years. This is a class of peptides that there were other generations of this drug before semaglutide and tirzepatide were released. And the safety data on it was strong. It's just when the weight loss conversation started and the Hollywood kind of, weight loss craze and people potentially abusing it, everybody started getting kerscuffled about it. And I thought that was also very interesting. Like, the backlash on the potential of having a successful weight loss tool. It was interesting how society has responded to that as well. I mean, that's a whole other conversation, but I was kind of shocked. I mean, when I started talking about it on my podcast, the backlash I got was very reminiscent of 2020 and kind of that whole time period of what was going on there. Mm-hmm. And I was like, I don't know, it made me raise my eyebrow. It just all, like, when everyone goes one way and raises their pitchforks, I'm usually like, I'm going to hold out over here and just wait and see. And it just wasn't adding up. And even the crazy statistics you're hearing about some of these horrific side effects, I'm not saying they're not real, but the information you're hearing is really inflated and exaggerated.
You mean about suicide, being suicidal, and
like it's very sensationalized. It's not what the data is showing. So
I'm gonna lean into it, and again, I took a really macro way up, because it's not that I wasn't interested. I'm trying to put my energy into other things. So the things that was coming at me, I was hearing was, okay, so for every pound you lose, you're going to lose a ton of muscle. 2 pounds of muscle per pound that you lose, like sort of like that. And maybe these are just some of the things I heard, that you could get depressed. It could paralyze your stomach so that now you're not making serotonin in your gut. You could get off of it and your stomach's still not going to work correctly, or you're still not going to be able, or you're going to lose too much weight. So these were just some of the things I heard. Not to mention, I have seen people who probably are doing too much.
Yeah.
And like, I'll be honest, like the skin on the legs and
the waist.
It's wild.
Yeah, it's wasting.
It's so interesting because I think, do they think that's better just because you're smaller? Right. For me, as somebody who's into like fitness and kind of vitality,
right?
When I see that, I go, I'd actually rather have a few pounds than some of that. So these are the sort of the messages that I heard. And also it felt like if you could afford it, so there's always that element. It's a hack. And I always believe that hacks have a place, but sort of if you're doing the fundamentals.
Right.
I love a hack if you're training and getting to bed and trying to do the things you're in charge of, right? Yes. But this is where I needed to be educated, because before we switch, I don't want to switch. So on those things, but then now I'm hearing, helps PCOS. It helps, with some heart issues. It helps with blood pressure. Besides the weight, then you have, it's anti-inflammatory. Like, there's a lot of things also that you hear. And I'm totally open-minded to peptides.
Right.
So where did it switch? And so I guess maybe we could sort of discuss, is it the dosage? Is it simply that? Is it just that?
I believe
simple?
so. I believe so. So it's a signaling peptide hormone, and just like insulin is, just like leptin, ghrelin. Given at high doses, that's a disaster, in my opinion. So that's where I was asking everyone, are you microdosing it or low dosing it? Or is anyone doing tiny doses to supplement physiologic deficiencies? I was looking at it that way, because you could have a subclinical hypothyroidism that's devastating, that leads a patient into chronic pain and migraines and all kinds of issues, cardiovascular issues. The allopathic medical system will be like, they're fine, their labs are fine, they're fine. They're not fine, right? You give them a little bit of thyroid and the whole world changes. Or a little bit of estrogen, or a little bit of testosterone. And I was like, what happens if you give a little bit of GLP-1 agonist? What would happen? And so I started playing with it on myself.
I was going to say, how did you even dive into it?
Well, I was just telling, my friend off air, I was having really severe cognition issues as I was heading into perimenopause, and then COVID on top of it. And I pushed back really hard during that whole thing with my platform. And so
so you got some heat.
A lot of heat.
And great stress.
A lot of stress. Yeah. And, that all together culminating was not so great. My grandfather died of MS. So I was looking at symptoms of basically anytime anything hits me, it hits my neurologic system. So, and when you're a high functioning female, when you've got a lot going on and you are used to being highly cognitive and having mastery over that, and it starts slipping, it's noticeable. Yeah. And so I thought, well, I wonder if I just take a tiny baby dose and see what happens.
Do you take it with something else? Is it coupled with another?
Well, so I use all the peptides. So it's, there's bioidentical hormone replacement going on here. There's other peptides that, depending on, are we trying to regenerate tissues? Are we trying to quell neuroinflammation? What are we going after? And then what's the short-term goals? What are the long-term goals? Is this something that, and this was all independent of weight loss. Yes, I had about 20 extra pounds on me from all the stress. That was very nice to let go of, but that was not what my goal was. My goal was to get my brain back on, get my autoimmune disease under control, because during all of that, my psoriasis and psoriatic arthritis exploded and my spine was fusing. And I'm a very active person as well, and I couldn't move and I was in horrific pain. And I was like,
is this all stress induced? You have a genetic predisposition for some of this, but meaning that's how you respond?
I think it was stress and
timing your age.
Shifts of, I'm 50 years old. So I was just hitting that shift where it's pronounced. It can be.
Hormones are a real drug. Everyone, like when people freak out about male behavior and testosterone, I'm like, I don't think we give it
no, it's
the honor that,
It's a shift. It's just one day things are okay, and the next day the wheels seem to be falling off the car. And I had been, my own bias as a doctor, I had these women coming into my clinic all the time who were our age, and I was in my 30s, and I, secretly in the back of my mind, I'm like, sucks to be you. Like, that sucks, But here's your hormones, and you're just not trying hard enough, we need to do more, you need to do more, or we need to do more. And they would say, I'm doing everything by the book. Their diets were more restricted than they needed to be. And this 20 pounds came out of nowhere. And that's kind of the beginning of the issue. I don't think people realize what low-grade insulin resistance leads to more severe insulin resistance. Losing your insulin sensitivity is kind of that's the root cause of a lot of issues. Sure. And then a decade later, they gain another 10 pounds, and our friends, like in our age group.
Yeah, they're always trying to tell me how it is and how it's going to be.
And it's real. And so it was happening to me. It was happening in real time. And I was like, oh no, I call it the thickening. I watched everyone in my family go through it. Yeah. And I was like, it's happening to me. And I tried harder. I tried harder and harder and harder. And it just,
that's more stress.
That drives the cortisol. Yeah. Anyway.
So wait, when you said that you respond this way, what are other ways that you have patients that they physiologically respond? Like you sort of suggested it was in more of a neurological way. Like, do people kind of manage stress? Like, how other ways does it show up?
Well, cortisol destroys your metabolism. So you start packing on the visceral fat, which drives more cortisol production, and you start to lose insulin sensitivity, and then you start to lose estrogen as you hit that age, that midlife age. that desensitizes you more to insulin. So you become more insulin resistant just by nature of losing some estrogen. And the whole thing starts to snowball. And I think it depends on a lot of factors. I don't think it was the stress that was happening just at that moment. It was a lifetime of, I mean, I have endured a lot of stress, and I was a single mom, and I was building a business. And I mean, it's, so you kind of go through the gauntlet, and you continue to go through the gauntlet. And I think eventually it was like I kept trying to explain it to my friends. It was like a fuse blew. Yeah. Like a fuse blew. And it didn't matter what I threw at it. I have access to stuff. I'm sure you guys can get it too, but like I have access to some regenerative wonderful things that I can put in my veins and I can inject anywhere, and none of it was working. And I started studying the GLP-1s, and the first thing I noticed was that it quells neuroinflammation and it helps with neuroregeneration. So something that helps regenerate neurons in the brain. We don't have anything that does that. I mean, I don't know of anything else really that does that. I was like, that's phenomenal. Then I was realizing that it was healing metabolism. It's not just a Band-Aid at the time, but it starts to sensitize you to insulin. And I believe the longer people are on it, the better their metabolism is going to heal. So it's like any other peptide. It's not just at the time that it's doing its work. It inserts itself where it needs to go. And so insulin signaling improves. Insulin secretion improves, and it times itself better. Anyway, all of it was adding up. Then the cardio regenerative properties, pancreatic regenerative properties. It makes your pancreas work better because the pancreas starts to poop out. Everything atrophies as we age. Yeah. And then I was reading that I remember sitting on the couch looking at my phone and turning to my husband and being like, they're lying. It's regenerative to muscle. It actually induces muscle protein synthesis. It does not destroy muscle. That 2-to-1 ratio you heard is nonsense. Anytime anyone goes through severe caloric restriction or any kind of crash weight loss, they're going to lose 20 to 30% of their muscle mass. They're going to upwards and upwards. So that is just a byproduct of people wasting. And I think they're being dosed too high, too fast, and it's crushing them. It's crushing their appetite. They're not eating. They're going into a malnourished state, and they're wasting away. And then they're not protecting their muscle, because getting patients to strength train is like pulling teeth. It's very difficult. And
when you say patients, do you mean all patients or women?
All patients, but women in particular.
They don't want to get too big. They're not familiar. The thing is, I think it's an intimidating undertaking if you haven't been introduced to it.
Right.
And also, they don't want to get too big.
Right.
That's my favorite line.
Yeah.
I'm like, do you know how hard it is to build muscle?
I remember I was telling you about my mentor. I was like, I don't want to get bulky. And he's like, have you seen Gabby Reece? She's not bulky. And I mean, this was back in the 90s. So.
I've been trying to get bulky for 30 years. Okay, so I just want to pick this apart just a little deeper. So do you use a compounding pharmacy? And if somebody goes, hey, because very few people are going to be as educated, and when you say slow, or do you have patients you've put them on to boost them and then take them off? Or is it sort of like, hey, I had somebody tell me once with the hormones, it's like, if those hormones have packed their bags and they're gone, like, then you will be on this for, this thing, whatever this is, forever. And I get that, it's just aging and time. So do you have instances that you communicate, hey, this is going to be something that if you want this kind of result, it's going to be forever, and other patients where you go, hey, we're going to give you a little start and then you can have the choice to come off?
I think it depends on what the short-term and long-term goals are. So if someone's trying to induce weight loss, we're going to treat it a little differently. If somebody, and again, they have to do all the things. All the things are not negotiable, meaning the sleep, the strength training, the nutritional interventions, prioritizing protein. I've been preaching that for way longer than it was cool. Like, I was telling people to eat meat and deadlift when all the health, fitness, and functional medicine doctors online were telling them to do yoga and go vegan. So like, I get that whole thing, and that's been the premise of my entire platform for a long time. This is adjunctive. This is an add-on. Plus, there's, we have to balance the gut. We have to make sure that the hormones are balanced. And if this is something that's helpful to them, depending on what they're using it for, if we're using it for, say, high blood pressure or autoimmune disease, then it's probably going to be something that they take long-term. But I cycle just like I do hormones, and just like I do peptides. I mean, nobody goes on like BPC 157 and stays on it forever.
Right.
You do cycles of it. You're in a regenerative cycle. You might be in a weight loss cycle. It depends on what our goals are. But I have no problem staying on this at a low dose forever if it continues to do what it's doing for me, and if it continues to do what it's doing for a lot of people. I think that people are being slammed with it. Those pens, the brand name, the Ozempic and Wegovy and Mounjaro, those pens are preloaded at a dose that you can't control, or there's no variability there. It's just the dose that you get. Yeah. And so those are starting, in my opinion, too high for most people. And then they're being ramped up over about 16 weeks very quickly to these extremely high doses, up to, with semaglutide, they're being ramped up to 2.4 milligrams. That's crazy. I don't have anybody anywhere near that. I've got one patient who's got a lot of weight to lose.
I was going to say, what if you had a 400-pound patient?
He's only at 1 milligram.
One?
I think the key, though, is receptor sensitivity. Just like any hormone, you have to keep receptors sensitized. And so it's a matter of, are they doing the work? But this also, the cool part that I don't think anyone appreciates is there's impacts on the brain that are dopaminergic that give the onus of control back to the person. Right. And I look at this as an opportunity. It's like a window of time. So maybe they only want to be on it for 6 months to have weight loss. But usually when people have excess weight, they have a lot of other comorbidities going on that this is healing. So who knows how long they're going to be on it or what that's going to look like. I haven't been using it long enough to find out, but I'm guessing, like every other peptide and every other hormone I've used, that we're going to be cycling and we're going to be rotating and using it for long term. Anyway, we open the window, and maybe for the first time in a person's life, they feel control. And I've had many people reach out to me and say, I took it, and after a few weeks, it was like, this is what normal people's brains must feel like. They quit hyper obsessing about food, because there's leptin deficiencies. Yeah. There's leptin receptor insensitivity. There's resistance. There's all kinds of issues. There's genetic variables here. And some people really don't ever feel that normally. And so they get that feeling and they're like, I have more control. Now they want to work out. Now they want to eat better. Now they want to do all the things, and they want to implement the lifestyle variables that are necessary, but they haven't had either the discipline or even the cognitive control to do it. I don't know, because I don't live in their brain.
No, it's the $1 million question, right? I usually ask all my guests, like, what keeps people from being successful? Like, we have all the information, we have all the cards, and this is where again some of the learning came in for me. So coming from kind of I have a really blue collar attitude. I was raised, very simply. I live with somebody. It's like, if you can do it yourself, do it. Yeah. Like, that's how we are. And in doing the research on this, it never really occurred to me that there are people now that are full adults that are probably born metabolically dysfunctional. They were already damaged in utero. And maybe 100 years ago, we wouldn't have this conversation. I don't know, because we could say, well, then how come people, and we can get into food and our food business, right? So, because there's sort of multiple buckets. Yeah. That's what I sort of came away with. So for me, it's like, okay, we have the medical system, the doctors. I know you studied naturopathic for that very reason. It's like, hey, doctors, not up to, it's not their fault. They're sort of trained to work with pharmaceutical remedies. That's it. The notion, and they can say, hey, we want you to walk and do exercise. But at the end of the day, that's not what that model is. Right. And we know that doesn't work. Okay. So that's one bucket. Then we have the food system. So 70% of our diets are processed food. That is an issue also. Mm-hmm. I mean, because I want to get into kids. Then you have these patients, which is what I feel like after sort of hearing your point of view, you're dealing with the patient. You're dealing with the individual. You're sort of saying, hey, I'm looking at this individual person. How can I help them? And that's actually really different. Even though the patient is the one that suffers because of our medical system and our food system, is there opportunities to alleviate and help people that I didn't understand because this wasn't my reality, that you almost never have a chance. It's maybe like somebody who comes from a home that is abusive or, whatever. It's like, it's almost like they start out behind. So then they never even can get to the place to make the decision to walk, to make better food choices. And in my mind, I would have been like, we have to figure this out. But part of it is, how do we get as many people healthy as possible? Right. So it's a weird dance between we all need to all hands on deck and sort of need to figure out how to improve this system. But then here's this tool, this peptide. But then now they're talking about with kids.
I know.
And this is where it gets funky, right? Like what, a 6-year-old, a 12-year-old, because if it is considered, and they're calling it a drug for life, then we're just band-aiding, right? We're not sort of saying, hey, why do we have soda machines in school? Let's look at school lunch. It's atrocious.
It's atrocious.
So I could see where people that sort of come from my background get fired up, because it's like, oh no, we can't put a Band-Aid on this. People have to get the skills, but then it's sort of chicken and egg. And so I could see where here is some of the tension.
Yeah.
Right? So let's talk about kids. Have you treated any younger?
I haven't. I don't treat kids. But I had a sister growing up who was obese. My whole family is based. I come from a lot.
Yeah, I heard that you're with your dad. It's like
my dad's. Well, we're very blue collar Midwest folks,
yeah.
And my dad was vehemently against taking it. And I was like, Dad, you've got one foot in the grave.
But would he take medication?
Oh, he's on a whole arsenal of medications.
Yeah. Doesn't that ever trip you out?
Yeah, but he's like, but the TV said, I'm not taking this. It's dangerous. And I was like, all right, let's talk about this. So we had a conversation. It was all hands on deck. Like we had to have an intervention just to get him.
Was he obese when you were young?
Mm-mm. No, nobody was, but my sister was. And it was not easy for her. Like it was not, she was born in the late 60s and we grew up here in
But
Southern California.
Why do you think she was obese? Because sometimes it is a cycle. I think some folks are GLP-1 deficient. I honestly think there is a deficiency. So we have the data showing that those who are obese with fatty liver, with type 2 diabetes, and or that they have GLP-1 deficiency. We have plenty of data on that. That's what got me thinking about this, was like, well, wait a minute. Is that chicken or egg? Did they come out GLP-1 deficient and then develop these conditions? Or did the conditions cause the GLP-1 deficiency? And we don't know because there's no good way to test for GLP-1. But it got me thinking, and I don't want to speak for anybody, but when I look at someone like that you see, different celebrities that you see who've struggled with weight, there's almost, I don't know, I have this ability to look at people and be like, your thyroid's not working, your testosterone's low, or whatever it is. And I started seeing a pattern, and I think that some folks are potentially and there's some genetic, I don't understand it yet. I'm still researching it, but I've talked to different people who are way more into genetics than I am. And they're like, oh yeah, there's a genetic component to this where they are GLP-1 deficient. They have these SNPs. They have these, they have these genetic variances where they would be more prone to GLP-1 deficiency. So there's something here that we don't know. And I'm wondering if people are coming out like that. And then you mentioned in utero, we have the data on that. If your mother struggled with obesity and or metabolic dysfunction, the implications on the offspring are really devastating. And these kids are set up for life. Really, I mean, their chances of developing obesity and type 2 diabetes are sky high because of the environment that they were grown in, Well, it's both, right? So you get that all the time. Oh, I have my parents' genetics. Well, yeah, and you have their lifestyle.
Right, but I mean, just being bathed in excess insulin and excess blood sugars.
From the beginning.
In utero, inside the placenta. They are significantly, their tissues are already hypersensitized to this insulin. I mean, they're bathed in insulin when they're inside a mother who's metabolically dysfunctional. And that's like 94% of the U.S. adults. Right. So we're looking at offspring. Have you heard of Pottinger's cats? Have you ever?
Yes.
It's that. I mean, we're looking at...
Share that.
So Pottinger was a veterinarian in the 30s, and he was looking at cats, and he was feeding them... the story, when you hear it, people say, oh, he was feeding them the standard American diet. But back then, what was that, right? Yeah. It was way better than it is now.
We didn't even have the TV dinner yet then, so...
All he was doing was cooking the meat and pasteurizing the milk. He was feeding them cooked meat and pasteurized milk. And within a few generations, they were completely infertile. Their livers were enlarged. Their intestines were enlarged and boggy. It was a mess. And it took several generations to get them back to good health and fertility. So I would say our generation is probably at least one in. Right. We're Pottinger's cats.
And if we had young parents and they had kids young, so forth, we could almost be 3 in.
So our kids, and you have
3 daughters.
You've seen their friends and some of the, I mean, when did my daughter in high school, so many young girls were struggling with issues that like we never heard about when we were in high school.
Sure.
And the levels of PCOS, at young ages, just skyrocketing. And so, yeah, we could say it's toxicity, and it is. Yeah, we could say it's the diet. Yeah, it is. Yes, it's the parental habits in the household.
Yeah.
Yes, it is. But also these kids are being born with these propensities that are epigenetic. They're already coded basically to not have success. And so to answer your question, my thinking is this. Yes, we have to change policies. It's a disaster. That is a monumental, there's, Dr. Mark Hyman was saying he's been working on this for decades.
Yeah.
And it's just getting worse and worse and worse. And people are not listening. And, big food, big pharma, all of these, they're all in bed together.
So this is the other part. Because actually I had Casey Means on here. She's a friend of mine. And so all the drugs that get prescribed, the more there is, the more of that condition exists, right? So more statins, more issues, more, all of these things. So in this case, how is that different?
Because the conversation I'm having, honestly, at the end of the day, is using it in very tiny doses outside of weight loss. The conversation about weight loss is also a huge issue. And I totally acknowledge what you're saying. But when you have somebody in front of you, especially I could imagine a child, yes, we have to do all these things. And also we have an urgent situation right now. So what do we do? I'm worried about the human population as a whole and the fact that we're going extinct. Like we literally are not thriving in every country. Birth rates are way, way down. This is a real
What is it? 30% of under 30 in Japan are virgins.
Right.
Never mind, are we going extinct?
Yeah,
and there's not more babies being born.
Yeah.
People aren't even having sex.
Right. Because I don't even think that their drive is there. Who knows what their hormones are doing?
Right.
And I am all for what Casey Means is saying. I know her work.
I know you're in parallel with this idea of, hey, lifestyle.
But I think there's got to be some give and take of how do we approach this. I don't think the way the allopathic community is addressing GLP-1s is appropriate. I don't think that you crank somebody up on a dose and keep them on it forever all the time and you waste them away. I don't think that's the solution. I don't think most MDs have any clue how to deal with metabolic health. I don't think most naturopathic doctors have any clue how to deal with metabolic health. I know that for a fact because I'm part of that community. But we have to do something. And so my argument is like, where's the balance point? And I know not everyone practices like me, and I know not everyone has access to doctors like me. I understand all of that. But the conversation I'm having is there is another way to do this. And it was just something that I came up with, and I've been blown away by it. And I'm wondering if we can get this message out to more physicians and to more patients, if also patient empowerment and education, really understanding what it is that they're taking and what they're doing instead of blindly following the doctor's lead and just taking whatever drug they're given that visit. It's almost like every visit they go in, they get a new drug. And most people our age are on 5 different pharmaceuticals. It's insane.
Yeah.
So I don't have the solution
and I love
for the whole world.
Well, no, of course. And that's why I just want to start the conversation so people are aware of things that are out there for them, but in a way that supports them.
Right.
So going back again, I'm going to keep using my sort of perspective before this, which is like, okay, epigenetics, white knuckle it, switch the genes,
right.
Do that. But ultimately, a young kid is not going to be, if they're not in the environment. So if somebody had a baby that maybe was at a disadvantage and you gave the baby to our house,
right?
Maybe they would probably, it would still maybe be more of an uphill than like maybe one of my biological kids if I lived differently in my pregnancy and other, right? But so there is something where we do need the skill set to make the choices, yes. Right? We need the discipline to move. We need the discipline to say, I'm not going to eat that. I'm going to eat this. But I'm also hearing that people can't get there. Like they literally can't get there. But that part is the part that feels like the snowball that's gotten away from us, where we have the processed food. They make it taste better. They make it more affordable. We have it in the schools. I don't even know if sometimes people know what it feels like to feel good,
right.
To sleep well, to wake up rested, and to know like after you eat a meal, you don't have to suffer, feel gassy or bloated, but to feel like, oh, energized or other, right? I feel like in a way we've lost a lot of these things. So from this point of view of being open-minded and saying, hey, maybe this is a way to jumpstart someone into the right direction, do you have any ideas on maybe somebody doesn't have access to someone like you?
Right.
Because you're really paying attention. Like, I'm even going to check to see if you are exercising. Would you cut someone off if they weren't compliant?
Oh, yeah.
Like if they weren't doing the lifestyle part?
Oh, yeah. Absolutely. I just had this conversation with my father. I was like, this is no longer going to be supplied to you if you don't get your butt out of that chair and start moving more.
So what was the turning? He was scared of the things he heard. You know, the Kardashians were getting too skinny.
I put everybody in my family on it for different reasons. And
how about your sister? Is she?
No, I don't actually talk to my sister.
Oh.
So
family's funny.
Yeah. Family's funny.
So they call it family.
My daughter had a really profound turnaround on it. And
was she navigating something?
She was struggling. Okay. And she was struggling with, all of a sudden in her early 20s, she had, COVID. We were in Oregon. We're in Oregon. And it was crazy there during the last few years. And she, she was the only one of all of her friends who was like, I'm not participating in this. So she found herself very isolated and alone in her apartment. And she gained a bunch of weight. She's had PCOS symptoms since she was 6. I diagnosed her when she was 6 on lab work. I could see the changes happening at age 6. I wasn't in great health when I got pregnant with her, and nor was her father, which counts. Like the sperm counts too on that one. So, I mean, fathers who are metabolically dysfunctional definitely have an impact on offspring. It's not just the in utero environment. So she was kind of one of those, she's Pottinger's cat, she was headed in that direction. And her way of rebelling against me was to eat the junk. I didn't find bottles of alcohol under her bed. I found pizza and soda bottles, So her way of rebelling against the naturopathic mama was to do whatever it is that she wanted to do. I mean, when she was 5 years old, I kept her on such a strict diet to manage her health. When she was 5, she would like steal people's food out of their lunch boxes just to get the snacky foods that, they were allowed to have and she wasn't.
Absolutely.
So, or she'd trade like the beautiful home cooked meal for some whatever chips or whatnot. So she was struggling at this point and it was hard on her. She has cystic acne. She's a beautiful girl in her early 20s and she's carrying extra weight. She was very concerned about her fertility and she knows better. She's been through some training herself in nutrition. Like she knows what's up. And I said, hey, do you want to try this at a tiny low dose? Let's see what happens. And I'm not kidding, within 2 weeks, her skin was porcelain clear. And this is a girl who's had such severe acne, cystic acne, that she's hidden behind her hair since she was 14 to the point where she isolated herself all through high school and wouldn't go out with her friends or go on dates. We would have trips planned, concert tickets, and she would say, I'm not going because of a severe breakout. It was devastating. And I would not allow her to take Accutane because it's such a terrible drug. Her skin was clear.
Why did it clear up?
I think it's
because a lot of times you think acne is either an allergic reaction to something or the gut or something.
I think hormones. It was high androgens due to PCOS. And so I think it which is due to metabolic dysfunction at the end of the day. I mean, that's really been the drum I've been beating for well over 10 years is metabolic dysfunction. My colleagues used to make fun of me in my early days of practice. They're like, why are you running serum insulins and all of these metabolic markers on your patients? They don't have diabetes. And I'm like, au contraire, 80% of the people walking through my door at least all had undiagnosed metabolic dysfunction. And so someone would walk in our age group and I'd be like, you're sitting on the edge of diabetes. And my colleagues thought that was extreme. And here we are 20 years later and everybody's got
95% of Americans, right?
Or 94. And that was 2018 data. That was pre-2020. So
imagine COVID really kicked everyone's ass.
Yeah. I mean, especially in the States where lockdown was forever.
So dumb.
Yeah. So that's what I'm trying to get at is it heals the metabolism. And she's so young and her receptors were so responsive that it was just the smallest amount. So she's tall like you and she's beautiful and curvy and she loves her curves. And so she lost a few pounds, but she got right back down to a weight where she's like, I feel good. And she's curvy still and she's rocking her curves and she's good there. So I'm like, hey, whatever that is. Like, stay at that dose. Nope, there's no side effects. She's not having any nausea or vomiting or any of the terrible side effects, which we should talk about.
Yeah.
Like, amazing.
Yeah.
Her life is back. She's going out more. She got a boyfriend. She's living her life. I can't tell you how many things I put her on, natural and pharmaceutical, to try to help her.
Right.
Between antidepressants and spironolactone, things that are hardcore, birth control pills, which I hated doing, but it was like the only thing that would stabilize her. So all of those are gone, and she's happy and she's healthy. All her depression lifted, not just because her skin cleared, because she actually had clinical depression. All of this is gone. My daughter has her life back, and she's on the tiniest little droplet of semaglutide. And people are telling me that it's an evil, horrible drug.
And
I'm like,
it's a shot? Does she just take a little shot? Is it every day?
Every week, once a week.
Once
she
a
just
week?
takes a tiny
Can
little...
she do it to herself?
Yeah. And
in your thigh, in your butt? Where do you
wherever,
put it? Where you can handle it?
Yeah, where it's a tiny little bit in the fatty tissue, and she has her life back. You know, my mom has Crohn's disease, and she's had chronic joint pain my whole life. My mom has been, she's a tough bird. Like, that lady won't stop, but she hurts all the time. And she hurts at a level that most humans don't live at. And all her joint pain's gone, and she's on the tiniest little dose. So when somebody wants to argue with me about it, I'm like, my mom doesn't have to take ibuprofen every day. She doesn't have to take any of these hardcore drugs. Her Crohn's disease is under control. Her joint pain's gone, and she's on the tiniest little dose of a peptide. Like, there's a place for this.
But it feels like what you're talking about is actually different than Ozempic.
Yes.
And that's where I think the muddled message is, right? It's like, it would be like somebody talking about steroids and hormone replacement therapy.
Right. Yes.
Like, it feels like
Yes.
it's very different when we use the words like peptide and, BP157 versus what you're talking about is also known and has been made very public as Ozempic.
Yes. That's a great analogy. Like, anabolic steroid use in a bodybuilder versus
menopause,
us
hormone,
taking some testosterone
a
for
little
longevity.
Bit, right. Now, how is it impacting men? Because I know they go through andropause usually, obviously later in their 70s, and we kind of kick it off early. I mean, but prior to that, whatever, can be
I think they get
mid-40s.
I think men today are really getting hit early.
Those poor guys.
I know.
With their testosterone and everything.
Well, the world we live in, it's like an estrogen cesspool with all the toxicity.
We're not going to fix it, right? We're not going to fix the food system. The government isn't. Obviously, all the agencies that we get all of our, recommendations from, they're not really, I don't think they're valid. I think they're obviously paid for. And so I think people, it's like, rather than staying frustrated about that, there's a part of me that's like, okay, we're all going to have to figure out how to survive in this environment.
Exactly.
While we're trying to get them to make changes. I mean, that's what it feels like to me, because, we can die. We can die on a hill saying, oh, well, they shouldn't. No, they shouldn't,
Yes.
But they have been. And now we're 60 years in, and we're seeing how people it's destroyed our health.
Yep.
And listen, I'm all about accountability. I'm all about it, but that's easy for me to say, right? I grew up in the Caribbean. I had a pretty healthy parents. I got straight into athletics. I married an athlete. My environment really supported that idea. What about people who work very stressful jobs? They don't grow up in a home like that. Maybe they start off kind of on their heels, and this is what they're dealing with. So what about insurance? Doesn't cover any of this, right? Unless you're pretty big, unless you're really obese. Is there any insurance for people on this?
The insurance conversation's muddled. I've tried to get insurance coverage for Ozempic, because when people say, what's the dose, Dr. Tyna? The dose depends on how GLP-1 deficient they are. So my dad didn't even feel a low dose. Like, it made no impact on him, right? Okay. I think he's severely GLP-1 deficient, so he needs a higher dose. I'm trying to get prescription coverage for him with his insurance, and it was just a bunch of hurdles and hoops. And so I sent him to his primary, and his primary's like, we're not doing this, because it's a pain in the ass. Getting pre-authorization is a complete pain in the ass for a doctor. Getting pre-authorization for anything. It's just practicing medicine nowadays. It's just...
Yeah, it's a lot of paperwork.
The burnout
What do you have,
levels.
7 minutes with every patient or something like that?
And that was in the 90s we had 7 minutes with a patient. But the hurdles, I've never dealt with insurance. I've never been in that system because it's organized crime, in my opinion. But dealing with getting coverage has been challenging for everyone I know who's tried, and their doctors don't want to touch it. Their doctors don't want to manage it. Their doctors don't want to manage, because you have to keep tight tabs on your patients, and you need to obviously get them eating right and on the right path and protecting their muscle with protein and strength training. And most doctors don't have time or knowledge or the gumption to deal with that. So I think that's problematic, but I know people who are getting coverage. And since I started talking about this openly, I'm getting I have a decently large platform, and I'm getting hundreds of messages from people who are saying, women writing me emails. Not kidding. They all start like this. I am typing this through tears. Thank you so much for telling the truth. Here's my story. And their stories are amazing. And it's a lot of women like us who were doing great. And then all of a sudden, we give our whole lives to our children, and then they're out of the house and the wheels start falling off. They don't know what to do. They don't have access to high-end functional medicine practitioners, but their doctors suggest they try a GLP-1 once the weight starts coming off. I mean, I really wonder if I haven't been...
Wait, their conventional doctors will make that suggestion?
If they qualify, if they're, there's good doctors out there that are like, you're dealing with low-grade metabolic dysfunction. We need to nip this in the bud. And I wonder if I haven't been chasing my tail with a lot of patients in trying to balance their hormones and trying to balance their gut health and trying to balance their overall vitality, when really at the end of the day, if there was a tool that just got their insulin resistance under control first, all these things start to fall into place. They don't need so many hormones. They don't need all of these things, potentially. It changes...
Right, the load off the system so the system works better.
Yeah. It changes the gut microbiome into a more favorable, less pathologic profile. I mean, there's so many implications to this. And these women are just getting Ozempic. They're living in the Midwest or wherever, and they're just getting their Ozempic. And they're like, it totally changed my life. My depression's gone. I'm off my antidepressants, on and on. And then there's the young women who are in their 30s who have had 3 kids or 4 kids, and they blew up. They were thin, healthy women when they started having babies, and now they're dealing with extreme obesity, and they're living somewhere where they don't have access to all of the biohacking perks we do. And their lives are miserable, and they can't take care of their children, and they get on this peptide and they lose the weight, and they're like, I got my life back. I got my body back. I got my life back. One woman told me that she was able to actually get on a plane and go to Disneyland with her kids and go on the rides. And she's in her 30s. Like, there's a place, is all I'm saying. I'm not saying it's the panacea, but there's a place when done appropriately that we need to stop vilifying, because sometimes people really do have issues. I heard Oprah say, she said it so well. She said, obesity as a disease, not every obese person has the disease, but that there is a disease component to it. And I would agree. The more I've gotten into obesity medicine, there are pieces to this that are way more complicated that we possibly understand. And a lot of the data as it's been coming out has been suppressed because society doesn't want to hear it. Society wants to think it's all discipline. You're just a bad person. You have character flaws.
Yeah.
Deal with it. And I don't think that's the whole story.
No, and I would say that, if you asked me in my 20s, I probably thought that. And then obviously as you learn more. But there is a part of me that I'm still navigating, which is, at what also, though, are we letting you off the hook,
right,
to learning the important skills so that you can be as healthy as possible? Right. So that's sometimes the only other part is like, are we giving this relief, which I think is important, getting that distance, but are you simultaneously, yes, in your practice, but are these people going to simultaneously not eat those foods that we know are empty calories? And are they going to spend, 4 days at least walking 30 minutes? Right. Never mind lifting weights. Right. Like it's not that I gave up on that a long time ago, but I'm also in touch with the insanity that are people's lives, right, coupled with, the air, the water, and all the million things. Where I've landed on all that stuff even more is like, I'm going to make my immune system as strong as I possibly can to deal with it, because I'm not going to stress out. Yeah. I'm not going to walk around being freaked out. That's not productive. But that's sometimes the only thing where it's like, because we are so soft as a culture, our world, we're soft.
Yep. I agree.
Even if you took me and pushed me back 200 years, I'd be like, I'm uncomfortable. Like even someone who's supposedly I'm soft compared to what people have endured, how they lived, how hard they worked, how much they were on their feet, what they ate, how little they ate, how hard it was to get food. So let's just say collectively, we are soft, but are we just now going to find, oh, well, you're just going to take this and then you'll get thin. And it won't be about being also a human being.
And resilient. It's about resiliency. I mean, this, if anything, the past 4 years have taught us is that those of us who really honed our resiliency were the ones who were I was not afraid the last 4 years.
Yeah.
I was afraid for my parents who weren't that resilient, but I was like, I'm good. I'm going to be fine. And we were fine. I don't think there's an easy answer. I do know that information is more available than it ever has been. When I was back in naturopathic school, the things I was learning are now all over the internet in a million different places, which I can understand is also overwhelming for people and they don't know which way to go. But the information is out there. Brilliant books like Dr. Casey Means that just came out. I mean, we have so many of these great books that have come out. The information's there. People have to go search it out. And that's always been the premise of my platform is like empowerment through education. When you know better, you do better. All I can do is continue to make massive amounts of free content. And I have a podcast too, and I'm trying to get the word out as much as I can. Every episode's about metabolic health. Somehow I tie it back into metabolic health so people understand that this is the root cause. But some people, and I don't completely understand it, I know there's factors that I did not appreciate. I, like you in my 20s, was like, suck it up, buttercup. I mean, even in my 30s, like, suck it up, work harder. So there is something here that folks are derailing on. And I think some of it is out of their control. I don't know if it's genetic. I don't know if it's toxicity and environment. I don't know if it's messing with people's immune systems, inflammation due to infectious causes or whatever else, stress, whatever. Folks are struggling and it's getting worse faster than it's getting better.
Yeah.
And I've been in this world for my mentor. I walked into my mentor's office in the mid 90s and I have been in this world ever since, and it has gotten progressively worse. And what we're looking at long term with metabolic dysfunction is ultimately Alzheimer's and dementia. And what we're looking at from gestational views is higher propensity towards neurocognitive and neurodivergent outcomes. So on both ends of the spectrum, metabolic disease is destroying our species. And so I don't know where the answer lies. I just know that it's getting worse faster than it's getting better.
Yeah.
And I love Callie Means' work. I love Dr. Mark Hyman's work. I love that people are going after it and calling out the big food companies. I've been trying to beat this drum for a long time. It was not popular. I've taken a lot of heat, even from my own colleagues in my own community.
But heat for what? Like saying, what's to dispute? I mean, let's look at a bag of something and go, how, in what way is this going to serve us?
The popular, this is mind blowing, but the popular opinion in my world of naturopathic medicine now is that we don't vilify foods. We don't tell people that eating junk food is bad for them because that's elitist.
Is that for real?
For real. This is the ethical...
I think you have to be sensitive that people can only afford what they can afford.
Yes.
But frozen vegetables, at the end of the day, are available. In some ways, they might even be safer.
And more nutritious.
Right. Who knows what we got going on now, right?
Yeah.
How about the A-peel thing? Don't you love that? I mean,
So we're not allowed to talk about that because that's not inclusive. Okay. So this is
what I mean, kind of this softening and like, I want to, it's always about our feelings.
Yeah.
I also feel sometimes we're still our biological selves. And that's the other thing, a deep sense of well-being. And I don't mean happiness, because happiness kind of comes and goes, but let's just say that deep sense of peace or fulfillment and purpose and all these things. There's another part of me that goes, sometimes in the world we live in with the phone and the social media and the food and all the craziness, that if we still aren't encouraging people, and now it's like a foreign language when you talk about biology, but trying to get them to understand, I still don't think we can get that sense if we aren't doing some of the things we're biologically meant to, regardless if we take a compound that makes us thin or not.
Right.
And my concern sometimes is that with our world that we live in, it's like, I look good, I'm good.
Well, that's really apparent here in LA. As I walk around, it's bizarre how, I mean, such a severe amount of frailty in the...
Yeah, but I'm skinny. I'm a 0. You know, it's like...
Yeah, and I'm like, you're going to break a hip when you're 80. It's not good, you know?
But also, and be dried out and malnourished. And by the way, if you want your skin to look good, you better get the right nutrition.
Yeah,
period.
Strength train.
Right.
Those are the 2 non-negotiables.
That's the only, sometimes the concern. I'm like, oh, here we go. We've got another fix.
Right.
Of like something that will keep us, again, further from the natural things that...
Well, so it's regenerative. At the end of the day, it's anti-inflammatory, regenerative, and healing.
Right.
So that's the piece we have to look at is... so the SELECT trial was the one that they did on cardiovascular disease. And yes, it was paid for by the pharmaceutical company. So people want to dismiss it. There still was a 20% reduction in serious adverse events of cardiovascular disease, strokes, et cetera. The question came up after that was, well, that's just because people lost weight. And anytime you lose weight, you're going to have better cardiovascular health. True. They've concluded that it was independent of the weight loss. So a lot of these benefits that GLP-1 has on the body are independent of weight loss. They sit on receptors. They sit on our cellular receptors. Here's another interesting fact, because I've dug into all of it. I've literally I put in GLP-1 agonist and then I look at every condition and I've got it all broken down by body system. Significant reductions in pneumonia. And one study showed, it was a 2021 study in diabetes, the Journal of Diabetes, 80% reduction in death and ICU admission when type 2 diabetics were admitted to hospital for COVID, put on a GLP-1, put on semaglutide, 80% reduction in death and ICU admission. And
what is that? Why? Inflammation?
It sits on our immune cells. It impacts our immune system. That's the anti-inflammatory and the autoimmune component that I'm after with it in most cases. And interestingly, not a single person that I've put it on got sick this winter. Nobody got a cold.
Any downsides? I mean, I know from Ozempic, when I say Ozempic, I'm going to refer to, what you're doing is a peptide. I'm going to refer as Ozempic is, I don't know, 30% people saying they're throwing up, 80% feel nauseous.
Those are inflated stats. Okay. I don't know where people got them, but let's talk about those. So let's start with gastroparesis. Gastroparesis is most common and prevalent in those with type 2 diabetes. Hyperglycemia or excess blood sugar causes the vagus nerve to deteriorate. And so these people are already sitting on the edge of gastroparesis, and it's not uncommon in that community. So give them a high dose of a peptide that slows down gastric motility and throw them over the edge. And yes, there is the potential. Now, this is transient. It's not permanent. I don't know why people keep thinking it is and saying it is, because that's incorrect. It goes away. And even the data has shown after the peptide makes its way out of your system, it takes a few weeks, gut motility returns. So yes, that's a real risk. And I know people who got it on their first dose, and I don't know why. So maybe the dose was too high for them. That's the thing. It's like, what's the low dose? It depends on the person. So there's gastroparesis. Pancreatitis. The most common risk for pancreatitis is throwing a gallstone. And the people most at risk for pancreatitis are those with fatty pancreas. Those with fatty pancreas are those who are sitting in metabolic dysfunction and type 2 diabetes and obesity, just like fatty liver. So they've already got pissed off pancreases that are already sitting on the edge, very high propensity for pancreatitis. And then we put something in their system at too high a dose, slows down gastric motility, cuts their appetite. They stop eating. When you stop eating and you're already sitting on the edge of gallstones, your gallbladder gets sluggish, the bile sludges up, you throw a stone into the pancreas, boom. So if someone's crushing Chick-fil-A, they go on Ozempic at a high dose, they're still crushing Chick-fil-A, and they piss off their gallbladder. They throw a stone into the pancreas, they get pancreatitis. The peptide didn't cause the pancreatitis. They were already sitting on the edge. The thyroid cancer thing, it's not a real thing. The data has come out in recent weeks even. There is no risk of thyroid cancer, though the black box warning is on rats. And these rats, interestingly, are prone to this type of medullary thyroid cancer. It's a very rare type of cancer in humans. It's very common in rodents. And the control group, if people actually look at that data, the control group, all of the rats, they were on massively high doses. They put them on crazy, like 10 times the human dose. The control group also got spontaneous medullary thyroid cancer. And I used to have pet rats. I grew up with rats, and they do develop spontaneous thyroid cancer. All kinds of cancers, actually. So in humans, looking at it longitudinally, correlative data at best, but guess who's most prone to thyroid cancer? those who are obese and those who have type 2 diabetes, they have a 1.5 to 2 times increased risk of thyroid cancer. They develop thyroid cancer much more readily than their lean counterparts. So we're looking, and I could go on, but we're looking at a group of people who already are sitting on the edge or having high risk for some of these conditions, and then they're being given super high doses that I think are too high, too fast, and they're being thrown over the edge, and then they're developing conditions, and it's being blamed on the peptide.
Right.
And in the SELECT study, the control group had more pancreatitis than the treatment group. So this is nuanced, is all I'm saying. I'm not saying absolutely not, these are not real risks, and let's just, throw caution to the wind.
Well,
it's
everything
fine.
is also, whenever we take anything,
there's risks.
There's risks.
And can we, we are the generation that got screwed out of hormonal support because the studies that came out 20 years ago saying that bioidentical hormone replacement was dangerous. And now they've turned around and said, oh, that was all nonsense, which we knew. And I was given hormones the whole time because we knew in the bioidentical hormone community that the study was flawed and that they were giving progestins instead of progesterone. And therein lies the problem. Same time period, studies were coming out saying testosterone was going to kill you, but they weren't looking at these men. These men were smoking, they had abdominal obesity, they had high aromatase.
Well, it's like meat studies versus vegetarian studies.
Yeah.
Right? Like they throw every person who eats fast food into the meat category. Yeah. And we all know that even if you're a vegetarian, the fact that you're eating vegetarian makes you probably a little more aware of your food. Right. And therefore a little more healthy. Right. So I never bite into that. Maybe we can just go back to the kid part.
Oh yeah, the children.
Yeah. So it's always, it's just, I feel like it's more sensitive. And I know people are, they're prescribing all kinds of antidepressants and all sorts of things to people in high school and even younger, which really blows my mind. It's like, as we cut athletic programs or physical fitness in school, we put in soda machines and then medicate them. Yeah. And I know, listen, it's a great business model, right? Now I have a patient for like the next 70 years. So I get all that. But where do we stand on that? If we have a 12-year-old or a 13-year-old, is it really case by case? I think
we have to look at the child. Well, for one, most cases of childhood obesity, there is parental obesity in the home, and I'm not blaming anyone. It's not necessarily that these people are eating poorly and feeding their children poorly. They might just be struggling with obesity as a disease, and the children now are dealing with this too. So that's one component. That's very difficult to change. Kids only have access to what they have access to in the home. And sometimes these parents are doing the very best they can, and they're feeding their children according to what they know, and they don't know any better. So that's a big piece of the puzzle. We have to look at the child, and some of these kids are already in deep into type 2 diabetes, and they're in deep into cardiovascular disease by, age 10, age 15. What do we do with that kid? To me, I'll tell you something one of my mentors told me. She said, we're going to do emergency medicine right now while we change your lifestyle. That was her premise of naturopathic medicine. Sometimes we pulled out the big guns and we pulled out the prescriptions and we pulled out the hormones. And my other mentor that I mentioned to you taught me this as well. We pull out the big guns, emergency medicine for now while we change lifestyle. And that's a tough one.
People don't want to hear that.
I know.
I don't even want to hear that. I'll be honest. Like I said, I've had to really look inside my values and my beliefs on this, because it's not about the way I would do it. It's really trying to figure out where people are at, and also how our system has helped create an environment for a bunch of people that now are behind the 8 ball.
Yeah. And some of them are really far behind. And I'm with you. I mean, I have been carrying the flag for decades on the corruption of big pharma and big medicine. And I became a naturopathic physician because I was actually pre-med my whole life. Since I was 5 years old, I wanted to be a doctor. And I got halfway into it, and I was like, this system is so messed up. And I had been a patient of it my whole life. And I was like, this is effed. I do not want to become an MD. I wouldn't become an MD if you paid me. And then I met my mentor, and I was like, I didn't even know there was this other path, right? I had always been taken care of by chiropractors. I'm a chiropractor as well. In my core, and chiropractics is pretty hardcore about nature first, right? I mean, they're even more hardcore than the naturopathic doctors after the past few years I saw. Yeah. So I am tried and true. You have to put in the work. Sometimes giving somebody a leg up to do the work is where I stand. And I meet the patient where they're at. So if I can give them a little something to help them get the onus of control back, get some control over their decisions, their food choices, feel better. The other thing is the anti-inflammatory properties of these peptides, at least I noticed immediately, and many of the people I'm treating with it have noticed, you start to unglue. And the chronic pain that a lot of people are in, that's keeping them from being active, starts to resolve itself. And then you want to move. So my movement went way up when I started on them. And I was able to endure a lot more than I was prior. So it's nuanced. There's pieces to this where like I have to deal with the person in front of me. Yeah. It's not a one size fits all. It's not a Band-Aid. It's not a panacea. You got to put in the work. If you're not putting in the work, this is the conversation that I completely agree with everybody who's vilifying it. You put somebody on this who's a brittle diabetic, you crush their appetite, they become severely malnourished, they lose all their muscle mass because of the caloric restriction, not because of the peptide. They are going to be a disaster at the end of this. And then insurance is going to pull the card and say, you can't have this anymore, because it does tend to run out after like 6 months. Kind of depends on the company, the insurance company and their standards. But these people are going to be thin, malnourished, osteoporotic, and metabolically devastated. Yeah. That's what we're looking at in the general terms of doctors who are just frivolously passing it out. But look at most doctors. Yeah. I mean, most doctors are a mess too.
Well, yeah, and they don't think lifestyle has anything to do with your health.
No, I mean, when I started in practice, it was 2008. And I remember patients coming in saying, oh, my doctor sent me this letter after I got my labs drawn. And he said I had fatty liver, but that was normal. And I'm like... Fatty liver is devastating. Yeah. You're headed towards cirrhosis. Like, this is not okay. And they're like, well, and I'm like, who's your doctor? Like, does your doctor look fit? Does your doctor lift weights?
Oh, yeah. One of my favorite lines I've ever heard 20 years ago, Paul Chek.
I love Paul Chek.
Oh, yeah, Paul is the best. He said, you know, your doctor and your trainer should practice or train you as close to naked as possible, so you see how their practice is working for them. And I was like, easy for you to say if you're you, Paul Chek. But in a way, that's true, right? Like, I mean...
the normalization of pathology in the past 20 years has been just mind-blowing. Like, we've totally normalized type 2 diabetes. Type 2 diabetes used to be adult onset diabetes. Now it's everywhere in children.
I have an uncle, Dr. Reece, Dr. Teddy Reece. He is a diabetes specialist. And he was one of the only people in like the late 80s that would ever see children, because it didn't exist. And I remember him sort of saying, yeah, I get sent sort of these unusual cases.
No, it's everywhere.
Yeah. So cost, because this, you know, once again, is only people who can afford it are going to be allowed to be healthy, right? So I can afford to buy good food. I can afford to have a gym membership, now afford this. But in general, I know they were saying that it's really inexpensive, and, you know, it's less in maybe Canada and certainly in Denmark. But here it's Ozempic, it's maybe $1,600 a month, or
it's like
somewhere.
$1,000. It's stupid. I think the study that came out a few months ago was like it cost them $5 to $7 to make a month's supply, and they're selling it for $1,000 a month.
It's a good business model.
Yeah, it's ridiculous, and it's like $150 in Canada, $60 in Germany for a month's supply. So we're getting hosed as Americans.
And what about for you? Because it's lower dosage, does that mean it costs less, or because it's all customized? Is it you're paying for that?
A vial of compounded semaglutide costs anywhere between $150 to $200.
And how long does
it depends on the dose. Mm-hmm. So some folks it's costing them $30 a month. Oh. Because, well, here's the thing. This microdosing that I mean, it's kind of, we're having two different discussions.
Sure.
But the microdosing strategy really is reserved for those who are more metabolically optimized. So folks like you and I, and if, say, you had an autoimmune condition crop up, you would need a tiny dose, but it would work really phenomenally well because you're so metabolically healthy.
But I don't know that. See, that's the thing. We all think we are. Like, I have super genetically high cholesterol forever, since my 20s, because it's when I first got my blood work done. But so it's like you never know.
Well, if you lift weights a few times a week and your blood pressure is normal, you're probably, and your waist circumference is a huge indicator. Waist circumference is a big one.
Yeah.
Just keeping waist circumference in check.
It's what, fat off your organs, basically. I'm oversimplifying it for people listening.
My mentor taught me that way back in the 90s. He's like, keep your waist as small as possible, because that is the ticket. He was talking about metabolic health way back when, before anyone else was. I mean, there was no metabolic syndrome then. It was called Syndrome X, and he was vilified by our community for even treating it. So it's been an interesting few decades. Anyway, women, 35 inches. Internationally, that's kind of the standard. An easy way to do this is, well, you're so tall. Half.
That's right. Try to take that into consideration.
Half your height. Well, no, half your height. So you just take your height in whatever centimeters or inches, half of that, less than half of that. That's your waist circumference.
I weigh 180 pounds.
Well, the weight isn't the issue. It's just your height cut in half. Your waist should be smaller than half of that.
Oh, well, I am doing good then.
Yes. So that's the red flag zone, is half of your height. That's
really?
Yep, men or women. And for women,
amazing.
For women, you want to measure about 2 finger widths or an inch above your belly button at the smallest part of your waist. And men, you want to measure right at the belly button. That is like, if you have...
What are men? What's men? Same?
Well, it's 40.
Well, what is their number?
40.
Okay.
That's a red flag. That's too high. I mean, in my opinion.
I always love that too. That's another thing, if you're listening, is like you get standard blood work and pretty much they're like, well, you're moving into the zone. Well, the zone is not optimum anyway.
It's men and it's 150 pound men. This is standard.
So,
half,
40.
Take your height in centimeters or inches, cut it in half. Less than that is where you want your waist, man or woman.
Okay.
If your blood pressure is in check.
Yep.
And if you're strength training 2 to 3 times a week. Like if someone came into my practice and I looked at their intake and I had that information, guaranteed their lab work would look great.
Okay.
Yes.
What about who should definitely not take this? Is there any instance that it's shown up where it's like, you know what, no matter what, we're going to have to find another way for you?
Folks who are not willing to put in the work and realize that there's work to do. But I lose faith in humans a lot. And I really do. It's been hard. Like my whole life, I'm like, what is wrong with our species? But well, because biologically though, we're set up to be lazy. Well, we're lazy apes though. Like we are just,
I mean, the thing is we just live in a weird world. Like it makes perfect sense. Where you like, can't you get this? It's like you weren't supposed to be flying around in the air in an airplane and like going to the grocery store. You know, we were just
eating all day long. Yeah. I know. But I do believe when people feel better, they do better. And when they know better, they do better. I really want to believe that. And so I want to believe that if you give people the information, and this information is out there and it is free and it is all over Instagram, you can find it. You just have to go looking for it. You have to be willing to read and learn. And it takes different delivery. Like if people don't jive with my style or your style, there's different styles. It's funny. My husband is like total, I call him like the smartest hick I know. He was raised out in the country in Oregon, and he is so great because he'll take the information that I deliver and he'll put it in his terms, and then he'll go, he's a blue collar guy. He's an electrician. He'll go to the job site and he teaches all these guys slowly but surely how to. Does
he use electrician analogies too when he's talking about it?
He's a farmer actually. So
these are some of the smartest people on the planet. They understand systems and they know how to pay attention and they know how things are connected.
So he teaches all these dudes how to do it. And like I want to have a whole podcast with him because his version is so just approachable. It just makes sense to people. Whereas maybe I'm too wordy or too doctorly, whatever. Anyway, get the information you need. If we do not empower ourselves to understand nutrition and the basics of fitness, we're dead in the water, I think, as humans. So I think that's just up to the human. That's their responsibility. Like, get your shit together. Yeah. I really tell people that. Like, this is you have to build.
Now you're really talking my language.
You have to build your health foundation. It doesn't matter what you put on it. It doesn't matter what hormones we throw at it or what supplements. Like, all of that is secondary. You have to build your foundation out through sleep, mindfulness, mitigating your stress, making sure you have your nutrition dialed in, eating nutrient-dense food, whatever that looks like. Usually doesn't come out of a package. Cook at home. It's cheaper. I'm so tired of that conversation.
Do you have we always talk about oils, seed oils and things.
If you don't eat out, you don't get stuck with seed oils.
Because they're in everything.
It's the whole eating out thing, and people really believing that fast food is cheaper than home cooked food, which is total BS.
I don't think it is.
No, I've done the math. Like, it's total BS. So learn to cook at home. I am not a good cook. I married someone who is. That was strategic. So learn to cook at home and eat simply and keep it clean.
Is there though any medical condition where you go, hey, we really have to check? Yes. To see if you can take this peptide?
I think anyone with gallstones is probably sitting. And so this is, and I don't mean this in any derogatory way, but in medicine, we learned basically that there is sort of like a phenotype for gallbladder disease. And it's usually, fertile, female, 40, it's basically kind of your estrogen dominant, robust, curvy,
Zoftic.
Middle-aged woman. That a lot of middle-aged women kind of end up looking like, and that will put you, and with probably a little more weight and curves, that's going to put you at more of a gallbladder risk. And so I think that's a dangerous zone to be in. Although those people are sitting in insulin resistance.
I was just thinking those girls are like, what?
They're the ones who need it.
Yeah.
So slow and low, and be proactive as a patient. You don't have to ramp up the dose. And I don't know any doctor that wants to put anybody on the highest dose necessary of any medication or peptide. Like, most doctors would be happy to hear, hey, doc, I'm doing all the things, so therefore I just need this tiny dose. Like, you can stay at the lower doses, even with the pens, Anyone with a family history of medullary thyroid cancer, even though that's been pretty much disproven, obviously it's a concern. Keeping close tabs. And anyone who has a doctor who's going to be dismissive and not work with them closely. I think it's really important to be working with someone who's willing to check in with you often. Most doctors are happy to do that. Usually for me, it was like pulling teeth to get the patient to come back in. They didn't want to make the time. So, really finding someone that's going to work with you. And if you don't get the answers you want out of your doctor, fire them and find a new one. But you have to be proactive. People are lazy. People don't, I get it all the time. I have a program where we talk about this and people are like, well, finding a doctor's hard. I'm like, everything's hard. Life is hard.
Well, what did I see that somebody will vet buying a television? They'll spend more time
than their doctor?
Yeah.
That's crazy.
And they'll say things like, I have a friend who is a doctor, really genius doctor, who said their dad said, well, they served coffee and had donuts in the office, so I chose him.
Oh, my goodness.
And we'll spend more time vetting where they and what kind of TV they buy.
Or if they take their insurance, which I understand is a necessity for some.
Of course.
But it's really there are many doctors out there, but it takes some time. It takes some legwork. You might have to, I went through like 5 strength and conditioning coaches before I found the one I wanted to work with. Like, it was a hassle. But there's good apples and bad apples in any profession. So
there's also been, I'm just curious, while you're here, it's cutting people's urge to drink alcohol.
Yes.
Is this true?
Yes.
What is that connected to, do you think?
It impacts the HPA axis and it impacts the dopaminergic firing. So dopamine, it impacts your dopamine. So it impacts your drive. And we all have different dopamine habits, right? Vices. Like, some people gamble, some people have too much sex, some people drink, some people eat sugar, whatever gets your dopamine. Some of us over-exercise, like whatever fires that off, and it quells that. I think that's where we're seeing some of the depression. I do want to address that, so remind me to come back to that. Smoking cessation, alcohol abuse syndrome. It's being studied for alcohol abuse syndrome, and I think this data is going to be positive, and that's going to get more insurance coverage. My husband is a total admitted alcoholic. Like, the guy loves to drink, and he loves to drink too much. And we keep him on semaglutide for his cardiovascular health. And so he doesn't want to drink.
Really?
And it's phenomenal. Yeah, it's crazy. So, and I've got people messaging me all the time. I've got one guy messaged me. He said, I take a tiny little dose once every 2 weeks, and I quit smoking and I quit drinking after a lifetime of abuse of both. So it's like, I wonder what organizations don't want.
I was going to say, I just started thinking about that. I was like, okay, booze companies, pharma companies.
Big tobacco.
Yeah,
snack food companies are very concerned. Dialysis clinics. Type 2 diabetes is very profitable. It's a very profitable industry. And I've said this since I was in my 20s. They want us slow, sick, fat, and dumb.
Yeah, for sure.
Because then we're pharmaceutical patrons for life. Joint replacement companies are concerned because all boomers are headed for hip and knee replacements.
I have a knee replacement. But mine was from overuse.
Yours from volleyball.
Yeah. But still.
Yeah.
Striker. But let's go.
So there's a lot of industries that have something to lose here, and I just speculate. Also, the need for other pharmaceuticals would potentially very decreased. So maybe these drugs that many people go on and seem to have no issue with, like, I'm going to be on a high blood pressure med for life, I'm going to be on a statin for life, and that's just it, it's okay. Oh, but my niece is on Ozempic, and that's forbidden. Like, it's very weird. I'm getting messages from people right around Christmas. My followers started messaging me saying, I'm so glad your podcasts came out and I was able to get the real information, because I went home and I'm 20 pounds lighter and all my PCOS and diabetes is reversed, and my relatives who are all boosted up and on 5 different medications were shaming me to no end. But they have no problem with their lifestyle medications. And I'm like, it's interesting because maybe maybe the big pharma companies who don't have a GLP-1 in their arsenal might be not so happy. I'm just guessing.
Well, you can't really patent them, right? And also right now the FDA is going for it, right?
I think they're trying to pull it.
You know, Dr. Conover, he works a lot in peptides. But a lot of people, and I know a doctor here in California, they have come down so hard on peptides.
Yeah.
At least, definitely in California.
They took our peptides away, most of them, at the end of November 2023.
But what's the
FDA pulled them.
Yeah, I know.
Because they work and they heal you. I mean, they're healing, they're regenerative. The reason this is a prescription is because it got co-opted by Big Pharma because of the delivery. You mentioned that in the beginning, the delivery being an injectable. If it was oral, it wouldn't be patentable. I mean, it would be something over the counter. We can get BPC 157 over the counter. We can get a lot of peptides over the counter because they're oral.
Yeah.
If they can sustain that. So, yeah, I mean, there's a lot to this.
That's what I'm saying. Like, we go through Hollywood. We show how people lose their mind and overuse something. And you have thin people getting thinner. So then people like me certainly will look at it and go, well, that's ridiculous because it seems like speed, basically. Yeah. And then you have the FDA that's suppressing peptides that we know.
And they're really coming down on the compounded versions of these as well.
Remember 6 years ago, they were trying to shut a lot of compounding pharmacies.
Yeah.
It's amazing.
Yeah, it's really interesting. And I mean, we're old enough. Remember the whole fen.
Oh, yeah.
There's room for abuse with anything. So there's going to be doctors that prescribe it in an abusive way to satiate their rich patients.
Make money, sure.
And there's going to be patients that abuse things. And I have no control over any of that. I just know that vilifying the peptide, that's really my argument here is...
You shouldn't call it Ozempic.
I know.
You shouldn't. You should not call it Ozempic. Nobody will know what the hell you're talking about. But actually, I don't think you should call it that. I think you should just call it by its name.
Yeah, just GLP-1.
Yeah.
Yeah.
I mean...
People don't know what that is. And so it's been, I don't know, it's been a really interesting... I do want to talk about the depression thing.
Yes. Because it is categorized, is this right? Like it's a class of peptides that maybe, I don't know, this is another thing you can see how much I looked into it before this. It was sort of like known to make people depressed or...
I think that's incorrect. Okay, back up. When people lose a lot of weight, there is a higher risk for suicide and depression. That's a thing. And we don't understand the mechanism completely. I've seen it happen.
Do you have a theory?
Yeah, I've seen it happen with patients. Well, for one, your estrogen stores are depleted significantly. Your belly is where you hold your estrogen stores. That's your little estrogen depot. So they're having a drop in hormones. It might be their hormonal milieu. It might be going too fast, and so they're not able to acclimate. Excess visceral fat will cause your testosterone to aromatase into estrogen. So we're looking at this kind of hormonal picture, whatever theirs is individually, and then it's being depleted quickly. So I think that might be a factor. Number two, and I noticed this myself, with semaglutide at too high of a dose, which for me was just a tiny bit too much, I didn't want to eat anything. And that can be depressing for people who use food to get that dopamine hit. They're used to getting their dopamine through food, and then they don't want food, and it leaves them feeling depressed. I'm just speculating. There's a lot to this. And then also there's a psychological component, which I'm not going to pretend to understand because I've never lived in a big body.
The death of that person?
It's a change, right? You're seen differently. You go through the world differently. I do know the other side of it. I've had many friends and people I love who were very thin at one point, and just most of them were like ferociously beautiful, and then gained a lot of weight to almost become invisible. Like it just was too much to navigate the world like that. And there's just a change that I don't pretend to understand. I do know when I've gained weight, I've become much more invisible than when I was thinner. So there's pieces to this that we don't understand, but the data does not support suicidal ideation at all. And they're still looking into it in Europe. I can also imagine just being on too high a dose and having your appetite crushed completely would leave you feeling potentially depleted because now you're malnourished. So
you're not getting fats and things that you need to support your brain function and hormones.
So I mean, again, it's nuanced, but it's not a clear correlation. Like taking semaglutide does not cause suicidal ideation. I think there's factors here that but even the rates, I don't have them in my head right now, but I was looking them up because this was a big question my followers were giving me. The rates were so incredibly low, and they were pretty much on par with suicide rates in general.
Right. Basic ones.
Yeah.
If someone is 30, they get their blood work done, they're pretty healthy, would they take this or consider this as a preventative for anything?
I think it depends on their clinical history. Like my husband his parents were both adopted, and his mom ended up with cardiovascular issues. His dad died of a heart attack. So for me, we don't really know the long-term health history. So I don't want to lose him. And he's had high blood pressure his whole life. And he really thought it was familial and genetic. But if I get him really dialed in, it tends to mitigate. For me, I'm going to keep him on this. Just a tiny dose long-term, because I don't want him dropping dead of a heart attack. And the cardiovascular benefits are awesome from what we're seeing. So it's cardio regenerative. So I'm like, let's do it, right? So
what about like if people who've had long haul COVID or myocarditis from other things, would that help them at all?
I'm trying to find data on that. I haven't seen anything. Speculatively, I would think if I were treating that patient base, I would probably be considering it, because it's the longevity, insulin sensitization, anti-inflammatory, neurocognitive benefits, like all of it is there. So something I try to explain to people when they say, have you looked into it for Hashimoto's, or have you looked into it for MS? I'm not interested in conditions. When a patient walks in the door, I'm interested in the patient and what their symptom picture is and why they're presenting that way, and homeostasis. So to me, if I understand the mechanism of, this is how I got into GLP-1s. If I understand the mechanism of action and I understand what my goals are, does this lead me to this? Not does this treat this? So
but does it mask, just out of my own curiosity, this isn't masking a root cause and only navigating the symptom.
It's healing it.
Okay. It's regenerative.
Yeah.
That's really important.
Yeah.
I really, appreciate the nuance of the conversation, because again, I'm of the belief I'm always learning, and I do want to circle back though, because I do think it's important, and part of the reason I want to have these conversations, besides learning myself, is it is at the end of the day the buck stops with us, no matter what cards were dealt with. Even if you had these parents that their lifestyle and you came, like I'm always of the belief of, because in the end what I always say is like, it's not going to hurt you or me. It's like, what does the individual person want? And I still think the only way to get what we really want is to take total responsibility for it. And we can all point in a million directions about like why it isn't the way it should be, and it's not fair. That's my favorite.
Yeah.
I had a friend, Mr. Wildman, he passed away. He said, if you want fair, you go to the fairgrounds. It's like life isn't fair. And I think also when we're looking collectively as a society, and actually when I say this as a global society, especially in developed countries, our food system, our medical system, and our regulatory bodies, they're not looking out for us.
They're corrupt.
Correct. So it's understood.
Yep.
It's like, this is how it is. So we all need to do our best to take care of ourselves, each other, and also hopefully then push and help, make changes there. But I do think there's something to be said for kind of using love and compassion also. We can't white knuckle everything, and to have a little bit of that, and maybe that boost to get people unstuck could be a really powerful tool for them if they take advantage.
If they take advantage of that window. And something that I think 2021 really drove home is my medical choices are my business and not anyone else's, and risk tolerance is important to consider too. And living in a larger size body where that adipose tissue is potentially very inflammatory and it's slowly killing them, and the cardiovascular risk, the kidney risk, the dementia risk. I don't think most people know that. Every time I post about Alzheimer's being type 3 diabetes, people are like, what?
It's very common. That a lot of doctors now, what you're saying,
are starting to appreciate.
They've been saying that for years.
Well, yeah, we had the data since 2008.
Even what's Perlmutter?
Yeah,
right. When he did Grain Brain, basically implied that. And how long ago was that? That book is 10 years old or whatever.
But even in 2008, I mean, my mentor taught me a lot of things, and I was saying it way back when, and people are just can't even hear it. They want to fight me every time I mention this stuff online. People want to fight me, and it's just risk tolerance. It's like I don't live in that body. I'm not the one dealing with the cardiovascular disease or the potential dementia or living in the dementia. what is their risk tolerance? Maybe they're okay with a little nausea and vomiting to not have this sequelae that's definitely going to happen. Like if the cardiovascular disease doesn't kill you, you will end up not knowing your name at the end of it. Like the path of metabolic dysfunction does not get corrected unless you actively correct it. It doesn't just magically disappear. And the sequelae and outcomes are devastating. So I don't want to be on dialysis, and I don't want to not know my name. I think that we have to look at the person in front of us and say, like, what's the risk to benefit ratio for you? Just like I didn't care if people wanted to get the intervention in 2021, not my business. I wasn't scared. That doesn't mean they weren't.
Sure.
Each his own, but it's not my choice or my decision, or like people are very concerned about other people being on this right now. And that's the part that's getting me. It's just like, they're doing what they're doing and we're doing what we're doing. And I'm not saying it's being done or managed correctly across the board, but there's pieces to this that are a little interesting of like people butting their nose into.
Yeah. For me personally, I don't care about that. I just was hoping we weren't going to have one more thing that was like almost compensating for the fact that everything else is fucked up and broken.
Everything is.
You know what I mean? Like, so part of me was like reacting to that, you know, like, but so, you know, we started this conversation by kind of like, you get some juice for this conversation. You get a little bit of heat.
Oh, a lot.
Okay. Well, one, it being in your practice and you seeing the benefits, why are you sticking your neck out?
I think it's just in my blood. I mean, I stuck my neck out in 2020 because I don't like propagandized medical information. And I don't like it when people jump on a bandwagon and vilify things or just misinformation. Really, there's a lot of misinformation coming out of even like my camp, my functional medicine community. And it's like, wait a minute, if there's benefit here, we can use things appropriately for benefit. Again, though, I became a naturopathic doctor so I could prescribe medication if I needed to, and also so I could take patients off of medication if I needed to. You can't take a patient off something if you're not licensed to prescribe it. So there's a place here that is very familiar to me with medicine. I'll end with this. My mentor taught me, if a patient comes in and their pharmaceutical use is way up here and their health is way down here, the goal is to get this as low as possible while we improve their overall health. And I'll tell you, patient after patient, for the most part, people are good and want to do better. And you get them feeling better and they do better. So we get health improvements. We may have to keep them on a tiny dose of something. I'm not going to vilify my patients for that. I'm not a purist. And it's funny, people will vilify Ozempic, but they're on testosterone replacement therapy. And I'm like, that's interesting because it's kind of same to me.
That's why we're not going to call it Ozempic anymore.
Right. GLP-1s. Thank you. This is good advice. Good business advice.
What skill have you developed in this last 4 years? Because you were saying that the criticism and and I think because women are more sensitive to criticism, where guys, I think they can blow it off easier. Yeah. And obviously there's crossovers, but typically, and maybe it's our hardwiring of our brain where we're kind of more susceptible to, you know, the perception of threat versus it's no big deal. What skills have you developed or practice have you put in place that it doesn't impact you as much? Or maybe it still does, I don't know. But have you had to kind of add something to make it easier on yourself?
I feel like I was kind of trained up for 2020 because I'm always the one that's like, hey, there's a big pink elephant in the room. And I mean,
yeah. You mean 6 feet, not 5 feet? Like, that's okay.
And people just turn on you when you say the obvious. And so I've always been that person. I don't know. I mean, I feel like I'm a little neurodivergent that way. And I just am like, well, this is so obvious to me. Why can't you all see it? So part of me just doesn't even register that it's not well known or well understood. And then secondly, I cannot stand injustice. I love science. I love it. I have been a scientist my whole life.
Which science are you talking about? The real science? Okay, just checking.
The one in all my textbooks. When I was a teenager, we lived by the library, and I used to walk to the library all the time and read nutrition books. So I was reading like Atkins Diet, The Zone, Protein Power, all of those books way back then because I was watching my whole family become obese and end up developing diseases. And so, I mean, when you talk about kids, I feel like when kids feel better, kids are smarter than adults. Kids will figure out what to do, even if their parents aren't doing it, you know, if you can give them a little leg up and get them. I'm not saying put all the kids on Ozempic, but I'm saying if a kid's really in the throes of metabolic dysfunction, it shrinks your brain and you can't think straight. So I sort of have always been that champion of like truth, if you will. And I deadlift. I deadlift a lot. And every time I deadlift, I have a mantra, like I am honing myself for whatever battle comes to me. And I believe in God. I've really developed a much deeper relationship with God, and God protects me so that I can speak the truth, because I think that's why I was put on this planet. Yeah. Even if it's uncomfortable, even if people want to push back, it's like, okay, well, I still know this to be true. And everything I said in 2020 has come to fruition, and I'm okay with it. I can stand in my power that way. So, well,
and you're the portal, right? You can't take it personal.
Yeah.
You're just representing something that people are uncomfortable with. Because even the fact that we could hear an idea that we don't agree with and we get upset, short of like hurting small children, I always find fascinating. Like, why are you so hysterical about an idea or something that's just different than yours? And like I said, I had to really go, okay, I'm going to sit and have an open mind about this, because I was in a different place. I
appreciate you having me on, because I mean, just your audience, you might take a lot of heat just for having me on talking about this.
Just, you know what we always say. But I'm okay with that, because we're just having a conversation and people will make their own choices. And like Laird says, you can come to our house. Just say it. Come see us. We'll have a coffee and we'll visit.
I have my coffee.
So exactly. So share all the places. I know you have a podcast, Dr. Tyna. You just share all the places people can find you.
Yeah. So the podcast is the Dr. Tyna Show, and that's on all podcast players. And my website is drtyna.com. It's DRTY.
Yeah, I was going to say it's Y,
Tyna with a Y.
Your parents were getting funny.
I know. I tell them, I was like, that was great for marketing, Mom. Thanks. Super helpful. And Dr. Tyna on Instagram and on YouTube. So that's mainly where I'm at.
You see patients all the time, and I just want to end it with, if people could do sort of 3 things that would be just a great starting point. Let's say they don't have any obvious health things going on, but they just sort of go, hey, I want to get a look under the hood. What are sort of 3 kind of reasonable starting points or invitations that you would make to people of what to look for, or what to consider?
As far as like lab work goes, or just in general?
Yeah, just to kind of say, I'm going to start and take a look. And I think, because the good news is there's so much information out there, but the tricky news is there's so much information out there. And I think sometimes, we call it majoring in the minors. I think people get way too complex soon. So just as somebody who's in this, what sort of tests or things do you like as a starting point?
I think what we talked about, which is what's your waist circumference and what's your blood pressure doing. Those 2 factors alone will tell you a lot. What's your grip strength? Can you hold on to a bar for 30 seconds and hang there? That'll tell you a lot about your risk for dying in the future. Knowing where your metabolic health is at. So simple factors like your hemoglobin A1C and your serum insulin, those will tell you, and a C-reactive protein, those will tell you how sugared up your red blood cells are, where your insulin is, and do you have inflammation? I think those are simple, easy lab markers to check on. And then how's your sleep and your sex? Mm-hmm. Like if you don't sleep and you don't have a libido, something's wrong and it needs to be corrected, because that's kind of, that's the way people go out when they start feeling not good. Yeah. Muscle mass, we could talk about squat strength and pull-ups and all of that, but I think just grip strength is really indicative of people's overall strength, and it's huge. It's huge for longevity. So
yeah, and if you're a female, I'd say be patient with yourself, because you can work on it, but our grip strength is just not naturally, as it doesn't come as easily. So I also remind them, like, do the best you can early.
Pick up heavy things and carry them around your house and put them down. Yeah. Like start there. And we do that, right? We pick up baskets, we pick up kids, we pick up dogs. I hurt my back the other day because I've got a gimpy dog she's 60 pounds. I carry her up the stairs every night because of her knee. And she leaped out and I pulled my back a little bit, and my husband was like, you shouldn't pick her up. I'm like, no, this is why I train. I train so I can carry my dog up the stairs, Yeah. So just being able to do the things we need to do, so we're not zombie bait, right? Like at the end of the day, we got to be able to
live.
Yeah. And not break a hip. I'm really just training. I knock on wood. Like I just don't want to break a hip as I get older.
Yeah, I'm with you. I think too, when I'm as a tall person, I'm like, that's a long way down. I don't want to mess with that. Do you have any must-haves in your own, I know this is not you're not suggesting this for people, but in your own supplement kit, your, sort of 3 or 4 things that you're that you say, hey, for me, this is the stuff I'm taking?
Magnesium is key. Our soil's really deficient. There's just so many upsides to magnesium, and then we're certainly not getting enough from our food, even if we eat perfectly. So it's just not in our soil. So a good magnesium supplement. I don't love supplements anymore. I kind of OD'd on supplements. I'm trying to think, what do I take every single day? I love myo-inositol. I think myo-inositol is great. It's really harmonizing for our hormones. It's good for insulin resistance and metabolic dysfunction, just kind of keeping your metabolism balanced. I think that's a good one that I make sure that I take every day. And I want to say vitamin D, but I'm such a big fan of the sun. So, somewhere in the middle there, I live in Oregon. So sometimes I have to take the D, and other times I make sure I get the sun exposure, but just making sure to keep vitamin D levels adequate.
You're not saying vitamin D, don't go outside. You're saying go outside, but maybe supplement with some vitamin D.
Yeah, kind of depends. And again, those who struggle with obesity and type 2 diabetes and excess adiposity will tend to have lower vitamin D levels.
Yeah.
So it's like this vicious cycle. And so I get it from both.
That's it?
Yeah. I just try to keep it simple. And I eat a lot of beef. And I deadlift.
You're really going to get us in trouble. Okay, that's all I'm going to say. And we did mention Callie Means, and I said, Casey, their book is out right now called Good Energy. And this is sort of another part of this conversation on metabolic health, and I think it's an important one, and I think the book is excellent. So we'll just throw that in there because we're giving a complete message.
Yeah, and I have lots of resources on metabolic health, free and paid, on my website. That's my whole premise. So.
The tree trunk of our health, right?
Yeah.
All right, Dr. Tyna Moore, thank you for coming here, and thank you everyone for listening. I appreciate it.
Thank you.
Thanks. Thank you for listening to this week's episode. If you want to learn more, there is a ton of valuable information on my website. All you have to do is go to GabrielleReece.com or head to the episode show notes to find a full breakdown with helpful links to studies, research, books, podcasts, and so much more. If you have any questions, please feel free to reach out and send them to @GabbyReece on Instagram. And if you feel inspired, please subscribe. I'll see you next week.